Good morning to you. Thanks for joining us. I'm Farah Nasser. Whether you're watching TV or online, Prime Minister Justin Trudeau is set to provide his daily update on COVID-19. We're taking a close look at Rideau Cottage right now because today this is happening. It's supposed to happen at 11, so any moment now. That's 15 minutes earlier than it usually happens. A lot of attention on the nation's capital today, not just for Trudeau's address, but also because we are going to see history being made. The first ever virtual sitting of the House of Commons. Also, we are expected to receive new modeling numbers from the country's top health officials at noon Eastern Time. We have with us today our reporters, Tom Vernon from Edmonton, to talk about what's happening in Alberta right now, and another state of emergency in Fort McMurray. He'll talk to us a bit more about that. Reggie Cecchini is in Washington, with now a third of the states easing up on stay-at-home restrictions, and Abigail Beeman is in Ottawa for us with the latest from Ottawa. Abigail, we're going to start with you. Canada is going to release modeling numbers today for COVID-19. What are we expecting?
That's right. Well, we're hoping that this will give us a better sense of where we're at and, of course, where we can expect to go. This is only the second time that Ottawa has provided modeling. The first and only time was April 9th, so almost 3 weeks ago. And at that point, a lot of numbers released there, but just to pick out one, at that point, experts were saying that with the absolute strictest controls in place, they were estimating between 11 and 22,000 deaths could still occur as a result of the coronavirus. So we'll see today whether those numbers are updated, what experts have to say, and that's coming after the Prime Minister's comments. But we're also expecting the Prime Minister any moment to address modeling as well in the focus of his remarks today.
One of the aspects of easing restrictions, Abigail, is to do with testing. Do we have any idea if Canada is ready or has enough kits for widespread testing as the top doctor in our country wants?
That's right. Well, it's certainly a question that's being asked every single day, and we know that the government is working to procure more of these tests, including producing our own domestically through contracts that they have secured. So it's certainly something that they're working on. The latest update from the government is that over 700,000 people, I believe it just popped in 1 minute ago, 740,000 people have been tested. And Theresa Tam said that over the past week, more than 20,000 people every day have been tested. But she's previously said that 60,000 a day would be a good goal to look towards. And of course, the situation differs province by province. Different provinces have different regulations about what makes you eligible to have a test. But at this point, we stand at about 20,000 tests a day. And Theresa Tam has said that 60,000 would be a good goal.
We are seeing today, Abigail, we're going to see the first virtual sitting in the House of Commons, which is going to be interesting. I know they had a rehearsal yesterday afternoon. Some of the MPs tweeted pictures of it. There seem to be a lot of people. Do we have any idea how this is going to work? Because it's going to be very different.
Well, it is going to be very different. It's something that has never been attempted before. I've watched some of these committee meetings, and there have been technical challenges when it's just a handful of MPs. You know, I've watched meetings being sidelined because an MP is not speaking into the microphone or can't hear, or then, complains that has interrupted his or her time or counted against her time. So I'm curious to see personally how this is going to unfold with so many more people, because the committees I've watched have been, in the neighborhood of a dozen, and now we're talking much bigger scope than that. But we know that the House of Commons has been working very hard to set this up, and I imagine trying to iron out all of the potential glitches that could come from a technical headache like this one. But again, first time that's ever been attempted, and we will just have to see how it goes, I think.
And watch people's facial expressions, because there's not going to be a lot of interjecting. It's a bit cumbersome. If anybody's been on a Zoom meeting or worked from home, they know that. Before I let you go, Abigail, because we have the warning for the Prime Minister, I think we're about 90 seconds away, but there's still questions surrounding the eligibility of who can apply for programs like the Canadian Emergency Response Benefit, the wage subsidy. We're hearing you can't have both. What do we know about that and some of the questions the Prime Minister still has to answer about it?
Right. Well, and that's an important one that you messaged. You can't have both. So if you apply for one and then later apply for the other, you might have to, or you will have to pay back the portion that you received or have it even out in some manner. And there are, I think, some specifics that haven't been cleared up about how exactly to do that the Prime Minister has been asked about. But he has been clear that if you're getting one, you can't get the other. We've heard a lot of concerns from a number of different groups, really, about eligibility. That's why the government released that calculator for the wage subsidy a few days before the actual wage subsidy portal was open, hoping that businesses would go through it, put in their information, figure out if they were eligible and move forward. And I believe the Prime Minister said 300,000 views had been, or 300,000 people had looked at that calculator to try and figure it out. But there still are questions about eligibility. We now see in the background are available on the government website. There's a lot of details about small businesses where the owner was not sure whether they would be eligible for the direct CERB benefit. The website makes it clear that they would be, even if they're not on the payroll, through a variety, as long as they've met the basic standards that are applicable for everybody in terms of not earning more than $1,000 over a 14-day period. But lots of ironing out to do in what is such a massive program that was rolled out in a short period of time. But there are certainly a lot of questions. Also, I should mention a lot of frustration from people just trying to get answers from Service Canada over the phone, online. They say, the phone lines are clogged. Global News has an article up where somebody says that they have called that phone line, they believe, 1,500 times and was still unable to get through to a live person when the government is saying, hey, this information is missing. We need it from you, but yet it's impossible to get through. So I know that there's a lot of frustration from some people who aren't able to yet get that money that was supposed to roll out the door fairly quickly.
Okay, here comes the Prime Minister. Thanks so much, Abigail Beeman in Ottawa. And here is Prime Minister Justin Trudeau outside Rideau Cottage. Let's listen in live.
Good morning, everyone. I know many of you have seen reports about my mum. I want to let you know that I've spoken with her and she's doing just fine. I'm thankful to everyone who's reached out and want to also thank the first responders who were there doing an extraordinary job. This morning, our thoughts go out to those of you who live in Fort McMurray as you deal with spring flooding. Minister Blair has spoken with Mayor Scott about the situation, and we stand ready to help. To all the first responders and volunteers out there placing sandbags, including around the hospital, thank you. Across the country, there are other communities dealing with flooding right now too. So to everyone, continue listening to officials as they work to keep you and your family safe. This comes during what's already a tough time, but I know Canadians will continue to work together. Shortly, I'll join members of Parliament from across the country for a virtual meeting of the House of Commons. Despite the challenges of this pandemic, our democratic institutions are innovating and finding ways to keep serving people. Parliamentarians are working together with the same goal, supporting Canadians and keeping our country strong. As part of this sitting, at noon, Minister Hajdu will provide an update on the new COVID-19 modelling, and Dr. Tam will also do the same. Based on the best data available, this is an updated picture of where we think we are right now and where we think things will go from here. They'll provide more details, but here's the bottom line. The measures we've taken so far are working. In fact, in many parts of the country, the curve has flattened, but we're not out of the woods yet. We're in the middle of the most serious public health emergency Canada has ever seen, and if we lift measures too quickly, we might lose the progress we've made. So we all need to be very careful for ourselves and especially for the most vulnerable, like our parents, grandparents, and elders in long-term care facilities. Earlier this month, when we released the first modelling, I said that the path ahead was up to us. And the same holds true today. How many new cases there are, how many losses we have to mourn, whether our hospitals can continue to cope. It's all up to all of us. You've already stepped up to help your family, friends, neighbours, and frontline care workers stay safe. And your governments across the country are stepping up as well. We're a big country and we don't always agree on everything. But right now, the premiers and the federal government are working together to fight this crisis. We need common guidelines to make sure that the decisions being taken across the country are grounded in a shared understanding and appreciation of what science and experts are telling us. Shortly, we'll be releasing the shared principles on restarting the economy agreed to by the federal, provincial, and territorial governments. Let me be clear. These are not the specific measures when you can go back to work or school or when you can see your neighbors or extended family or friends. This framework will lay out the things that need to happen before we take any next steps. Restarting our economy will be gradual and careful and will be guided by science. Here's what the guidelines mean for you. Controlling transmission is key. You already know that if your neighborhood doesn't have new cases, if your province is flattening the curve, this is a good sign for being able to slowly look at lifting some restrictions. So we need to know where things stand. To reopen the economy, there must be enough capacity to test and trace COVID-19 to control any new spread. For you, that means knowing that you'll be safe at work when you go back. You'll see lots more testing, and if someone around you does test positive, you'll be notified quickly so you can isolate. At work, there will also need to be specific measures and more equipment to keep you safe. And for hospitals, we need to make sure they can continue to cope not just for COVID-19 patients, but for everyone who needs care. And for certain groups who are very vulnerable, like seniors and those in long-term care facilities, strong measures will have to be in place for longer. This virus is taking a different toll on different people. We must be mindful of that. Whether you're facing domestic violence or living in a remote community or a long-term care facility, we're working on the front lines. We're here for you. Our priority is keeping all Canadians safe while getting back to normal as much as we can. Aujourd'hui, on publie les dernières prévisions sur l'évolution de la COVID-19. Dans bien des régions du pays, le virus a ralenti sa progression, mais on n'est pas sorti du bois. On fait face à l'une des crises de santé publique.
We're not out yet. We're facing one of the most severe public health crises of our country, and if we raise these restrictions too quickly, we could lose all the progress we have realized. Even if the trends encourage us, we have to remain cautious. And in some places, especially in long-term care facilities, we'll have to do even more. But as I have already said, every one of us will set the course for the future. How many new cases we will have, how many families will be mourning. Can our health system handle it? All this depends on us. The good news is that the people are doing the right thing to protect each other. But we have to continue staying home, do your shopping once a week or less, keep a distance of 2 meters apart, and follow public health guidance. Very soon we'll be sharing all the common shared principles to reopen the economy on which the federal, provincial and territorial governments have agreed. These principles establish the conditions that have to be in place before we can start stopping these restrictions. For example, the capacity for testing and following the COVID-19 has to be sufficient to follow the contagion, and that's why we're putting in place the necessary tools as quickly as possible. There have to be specific measures and new equipment to protect you at work. And for some particularly vulnerable groups, such as seniors and those in long-term care facilities, even more drastic measures will have to stay in place for longer. Our priority is to ensure Canadians' safety while life can get back slowly to normal.
I also want to provide an update on personal protective equipment, which, along with physical distancing, is key to keeping people safe. Every few days, we receive new deliveries of vital supplies for our frontline workers. This week, we'll be shipping over 6 million surgical masks to the provinces and territories. More than 100,000 face shields that we ordered from Bauer and Toronto Stamp are also ready and will be shipped out soon, with more on the way. Everyone deserves to be safe on the job. Indeed, On this National Day of Mourning, we remember those who died, were injured, or fell ill because of their work. And this year, we pay tribute to the thousands of frontline workers across the country who deserve not just our thanks, but our support. Aujourd'hui, je veux aussi faire une mise à point sur l'équipement.
Today, I also want to update the personal protective equipment that ensures safety of workers on the first line. We are getting shipments of medical equipment several times a week. This week, we will be shipping over 6 million surgical masks to provinces and territories. Over 100,000 face shields that we ordered from Bauer and Toronto Stamp are also ready to be shipped and will be sent out very soon. Everybody deserves to be safe at work. In this National Day of Mourning, we remember those who lost their lives, who were injured or got sick at work. And this year, we pay a tribute to our first-line workers throughout the country who deserve not only our thanks, but also our support. I would also like to remind everyone that the companies who need wage subsidies in emergency can now file a request. Since yesterday, over 44,000 companies have already filed for that online.
We must work together, and we must stay united. Now, more than ever, we have to stand up against discrimination and division. There is no place for racism against Asian Canadians in our neighbourhoods. There is no place for anti-Semitism, which B'nai B'rith Canada's report found to be on the rise in our communities, because hatred of any sort has no place in Canada. Today and every day, we are stronger together. Merci.
Thank you, Prime Minister. We'll now take questions on the phone. Over to you, operator.
Thank you. Merci. First question, Kate Bolongaro, Bloomberg. Line open.
Hello, Prime Minister. I have a question regarding the wage subsidy. We've heard from some businesses that it will cost them more money to rehire employees they've already laid off and had to pay out holidays and severance pay to than to bring them back on board with this wage subsidy. So some of them would rather leave their former employees unserved. What is your response to this?
Ideally, people will keep their connections with their workplaces so that they can know that they have a job to return to when this is over. And when the economy comes back, it will be all the quicker because Canadians will have stayed connected to their jobs. We were pleased that over 44,000 businesses have applied for the wage subsidy. But we know that there are a range of different situations across the country, and employers have had to take some very difficult decisions because of COVID-19. We've put in place measures to support the people who need support most urgently with the Canada Emergency Response Benefit and the wage subsidy. And we certainly hope that all these measures together will ensure that Canadians can continue to do what we need to do while caring for their families and come back as strongly as possible at the end.
Follow-up, Kate.
And now we've got a lot of personal protective equipment for the frontline workers. I'm wondering, do you expect businesses to chase PPP as well now that the reopening of the economy is beginning to be considered? And do you think there will be enough masks and gloves available for all of the businesses that will need them to be able to operate?
Our priority over the past weeks has been to ensure enough personal protective equipment for our frontline workers who are doing extraordinary work to keep us all safe. But we also know that as different provinces look at starting to reopen certain sectors, certain industries, certain parts of the economy, there is going to be an increased need for personal protective equipment. That's why we continue to procure massive amounts of PPE from overseas, while at the same time watching the Canadian production come online so that we can have our domestic capacity to rely on as well. We know that having the right amounts of PPE for industries that want to reopen will be essential before they reopen, and that's why we're accelerating the rate at which we are taking in personal protective equipment. Okay.
We know that the priority has always been to ensure that we get personal protective equipment for the first-line workers in the healthcare system, and that's what we've been working very hard on over the last few weeks. But now that we are considering the next steps, potential reopening of the economy in certain sectors, we know that we will need more PPEs, and we will make sure that we increase the quantity of purchasing of equipment, and that we ensure domestic sourcing of those equipments so that we can get that equipment necessary to more people before we reopen the economy.
Thank you. Merci. Next question, Laura Osmond, the Canadian Press. Line open.
Good morning, Prime Minister. I wanted to ask you again about vaccines. If and when a vaccine does become available, do you envision it being mandatory? And have you had those discussions with the provinces and territories yet?
We are still, unfortunately, a long way from having a vaccine. And just finding the vaccine is the first step. The next step will be producing the vaccines in sufficient number to inoculate everyone or almost everyone. That is something that we are preparing already in terms of manufacturing and production capacity here in Canada, because we know that countries around the world will be producing for their own citizens first, and we need to be part of that as well. As to what sort of vaccination protocols will be in place, we still have a fair bit of time to reflect on that in order to get it right.
Regarding vaccines, we know that we are still quite far away from that. There are countries all around the world that are still looking for a vaccine against the COVID-19, but even once the vaccine is found, it could be at least a year from now, there will still have to be sufficient production to make sure that everyone is protected. So we're setting up the correct production capacities here in Canada in order to be able to respond to the Canadian needs as soon as possible. As to the protocols, who will be vaccinated first, this is yet to be discussed, and we still have a long time before we make these kinds of decisions.
We've heard over and over how vital a vaccine will be because you don't fully understand the immunology of this virus. So how vital will it be to make sure that as close to everyone as possible ends up getting it in the end if one does become available?
We know vaccines will be extremely important. A vaccine will be extremely important to getting back to normal. There are situations and there are diseases for which vaccines have been searched for a long time. I think of HIV/AIDS, where there is still no vaccine even after decades of research into a vaccine. There are treatments to manage the spread of HIV, and there could be treatments that aren't a vaccine that could help us manage and get back to normal without a vaccine. But around vaccines, there are obviously going to be extremely important decisions around how to best get to that level of vaccination that will prevent further spread of COVID-19. There's a lot of studies done on that over the past years in terms of what threshold of the population needs to be vaccinated in order to prevent any spread of a disease, and that research will obviously inform decisions we take around the COVID-19 vaccine when it comes. Okay.
Obviously, there's an awful lot of research that is going on the subject of vaccination. What kind of vaccination threshold is necessary in a population in order to prevent further propagation of a disease? Science will inform our choices eventually, and what kind of decisions we'll make around COVID-19. But of course, it is always possible that a vaccine is not found. For over 10 years, a vaccine has been searched for against HIV/AIDS, and there is still no vaccine against it. However, there are treatments that are available to manage the disease much more efficiently than before. And other treatments might be available to manage COVID-19, even if a vaccine takes longer to produce than what we had hoped. But we're looking at all these different avenues of what to do in order to get back to a new normal as soon as possible. Next question. Next question from Denis Marquis from La Presse. The floor is yours. Hello, Mr. Trudeau. Concerning all of the different common principles in the national plan, you have said that the details would be revealed later. What does this mean? How long? And also, concretely, we've talked about the idea of perhaps preventing people from being able to travel from one province to the other. Answer. Melanie, this is a great question. So as to the common approach, the common guiding principles on which we have agreed upon between the federal government and the provinces and territory, we will be sharing that with you within the next hour. Now, these measures are not sunk in cement. They are rather guiding principles that will inform the different provincial or territorial governments according to their individual situations. For instance, as to transborder crossings, the provinces will look at the situation. The federal government will also look at the situation. We will look at the guiding principles, and we will see what kind of decisions should be made in order to ensure everyone's safety. This process will be evolving over the next few days and weeks and months as the situation evolves in itself because of the propagation of the virus.
One where the federal government and the provincial and territorial governments all came together to agree on principles that will underlie plans for economic recoveries. Those plans will be different from one province to the next. The specific measures put in will depend very much on the situation on the ground. But we need to be informed by a common set of criteria and measures to be in place before we look at reopening different parts of the economy. This is something that really, really matters. And all of us will be informed by these principles as we move forward on carefully reopening the economies in gradual ways.
Suivi, Melanie?
According to a survey, 33% of Canadians believe that a vaccine against COVID-19 should be mandatory. Where are you sitting on this question? Well, our answer, like I said, we're still very far away from making that kind of decision. Vaccines are not going to be available tomorrow, and there's still a lot of studies to be undertaken about the very nature of COVID-19, how best to protect the population. We know that comparatively to other vaccines, we need perhaps an 80% rate of immunity in order to stop the spread of a given disease. We don't know that if this is the same case in the case of COVID-19. All of this will be informed by the research and the science that is carrying on right now, including the task force that we have set up that will be working as of Montreal for the entire country, and that will be informing our decisions about the next steps to take.
Thank you. Merci. Prochaine question, Benjamin.
Next question, Benjamin Vachet from TFO. Yes, hello, Mr. Trudeau. Health Canada yesterday decided to lift certain restrictions on bilingualism for disinfectants. This measure was also taken for other products within the context of the pandemic, and it was a question of security, apparently. So why has this decision been made on the question of labeling on products that are coming from the United States? Answer, yes. For a question of the safety of consumers, all products must be labeled in both official language. But in an extreme situation, such as the one we are presently in, we must acknowledge that we have to balance vulnerabilities. And in certain situations, we are willing to accept unilingual labeling on products, but we do expect companies to work very hard in order to rectify that situation. This is obviously not desirable, and it's just unfortunate that we find ourselves in this very difficult situation, and we have decided to allow this temporarily. But of course, we would prefer for this not to happen, because linguistic duality is not just a question of identity, Canadian identity, but it's also a question of safety for the consumer. Question: does that mean that we are going to have to accept other types of exemptions like this in the next few weeks to come? Answer: well, we hope that that won't be the case. We hope that we will be able to have the correct labeling in both official languages, in French and in English, on all products as necessary. But we find ourselves in a situation where logistical capacity and labor isn't necessarily present in importing companies. And this is why we said to ourselves, it is better that products arrive regardless, and we want to make sure that we try and ensure the safety of all consumers nevertheless.
I want to start with the situation in Alberta. First, we have the COVID-19 outbreak of the meatpacking facility there, and now the flooding in Fort Mac. And you said in your opening remarks that your government is ready to help. I'm just wondering, will the military be brought in to help in that situation?
Public Safety Minister Bill Blair has already been in direct contact with Mayor Scott in Fort McMurray and spoken with his counterparts in the Alberta government. On the agriculture side, we've been engaged with the CFIB and with the relevant ministers in Alberta. We stand ready to help in any ways we can. And as in regards to military support, we're there for military support if we receive a request from the province. Nous allons être là pour aider.
We will, of course, be there to help all the provinces, whatever situation they are facing. If they need an intervention on the part of the military, we're open, of course, to it, but nevertheless, we need to have a request on the part of the provinces.
There must be enough capacity to test and trace COVID-19 to control any new spread. Dr. David Naylor of the COVID-19 Immunity Task Force says he's really concerned about testing and tracing capacity. So I'm wondering, how is your government planning to address those concerns as provinces reopen?
We know we need to do much more testing. We know that testing is an important part of careful reopening of the economy, and that's why we are increasing our capacity. Yesterday there were 26,000 tests, which is a new high, and we're continuing to increase the testing capacity with various things like more procurement of necessary swabs and domestic production, with production of the reagent, which is the chemical necessary to analyze the tests, done in New Brunswick right now to a quantity and a scale that is going to allow for larger scale testing across the country. There are many things that the federal government can do to support the testing protocols and capacities in the provinces, and we all need to improve on that if we're going to get to a place where we can open up carefully. Okay. Le dépistage à l'échelle.
Testing on a massive scale is obviously a very important element of the reopening of the economy, and this is why the federal government is working very hard with the provinces to increase their capacity. More tests were ever carried out yesterday, 26,000 around the entire country. Of course, we want to do more, and we have ordered more equipment and more elements having to do with testing. We are creating more reagent for the testing. This is being done in New Brunswick, and we know that there are many things that have to be done before the progressive and careful reopening of the economy. Radio-Canada, question. A more tangible question here. How many tests do we need to carry out before opening up the economy? You've talked about measures, but concretely speaking, how many tests do we have to carry out, and what other kinds of measures have to be set in place? Could you be very precise here and concrete here? Well, answer as concretely as possible. What region are you talking about, Mr. Vincent, specifically? I'm talking about the whole question. Answer. Well, what we have right now is a series of different pandemics across the different regions. It's very different from one place to another. In PEI, there had been at the total 20 cases of COVID-19, but in Ontario and Quebec, we know that the figures are much, much higher. So we have realities that are very different depending on the provinces and the regions and and from one city to the next. So for us, what's important is to allow each province and each territory to do the kind of screening that it needs to do in its regions, each community, in order to best respond to the needs and the vulnerabilities that are present. There might be some communities where they decide to test everyone. There might be other places where they need to test everybody in every workplace, or 50%. It all depends. There are different protocols depending. Our responsibility as federal government is to make sure that we have the increased capacity to make sure that the provinces can do the kind of testing they need to do and that they feel is necessary to do at that moment, at that place that they are looking at in a particular given time and place. We can't say exactly tomorrow we're going to need this or tomorrow we're going to need that. It depends on the situation. This is a continuous process, and our responsibility is to be there for the provinces to help them carry out the number of tests. Question. On the provinces, in your models, do you take into account the reopening of schools like they're going to do in Quebec or in Ontario? Can New Brunswick say, no, we can't have foreign temporary workers, for instance? Answer. Well, different provinces, of course, will have different approaches. There are pan-Canadian models, and our pan-Canadian model tries to take into account the different realities. But it will only be a snapshot of the whole country. The reality is that every difference is there according to the region, and regarding the kinds of measures that each province will take, well, they will be making their best informed decisions in what they feel is best for their citizens. Monsieur Saint-Pierre from Journal de Montréal, a question. To get back to the decisions on Health Canada, certain francophones are quite offended by this labeling issue. Senator Cormier has said nothing can justify an infringement of linguistic rights through this labeling. What do you have to say to that? Answer. We are in a situation that is completely unprecedented, and what is important is to have access to things like disinfectants or hand sanitizers. This is an essential part of what Canadians need in order to keep themselves safe. We had to make decisions that would, under normal circumstances, would be totally unacceptable. But in certain cases, we can allow a certain projects be imported in spite of the unilingual labeling. We understand that this is a far cry from ideal from a point of view of the identity of the country, but it is important also for the security of consumers. So we are looking for different ways to not have only unilingual labelings.
I'll ask you about Quebec's move to reopen its elementary schools and daycares. I know it's a provincial decision, but I'll ask you as a parent, if you'd be concerned about sending your kids back to school so early, and as a former teacher, do you have any concerns about the teachers who are going to be called back to the classroom?
I think many people want to see the economy reopening and getting back to a semblance of normality in the coming weeks. It is natural that after a long time in isolation, we would want to see things move back towards normal. At the same time, we know we have to be very, very careful. And there are plans and there are hopes that we're going to be able to see certain parts of the country take steps, including Quebec, around elementary schools. But we're not there yet. Those projections are for a few weeks off, and one hopes that the trend lines will bring us to a place where we'll be able to see that happen. And at that moment, as the Premier said, parents will be able to make their own decisions about what is best for their students and for their kids. Okay.
We all want to see an opening of the economy and going back to normal life as soon as possible. But we also know that this is a little way off or a long way off. Whether it's a few weeks from now, we are going to have to see if the present context applies itself, lends itself to that decision. And at that point, parents and schools will be able to make the correct choices to make sure that parents and children and grandparents are all safe.
Follow up there, because it was a question about what you would do if you were a parent. Have you given that some thought? In 2 weeks, would you send your kids back to school if you were in Quebec?
I would look at what the situation looked like in 2 weeks. We know every single week we see changes in how we're doing, on where there are outbreaks, on equipment and supports available. I'd want to know what the school was planning on doing, whether the desks were going to be properly spaced, whether there would be plans at recess in terms of keeping people separated. These are all details that need to be worked out to the satisfaction not just of governments, but of the school boards, of teachers, of everyone who works in the schools, and especially of kids and their parents and grandparents.
As a parent, when I make my decisions and for my children, obviously I want to know what the measures are in place. Are there going to be less students per class? Will the desks be more spaced out? What's going to happen in school during recess? Will there be plans to keep the children away from each other? Respect the distances. And what about the teachers and so on? We want to make sure that everybody is safe. Have the right measures been set up in case there are problems? All kinds of questions need to be answered, and all of those need to be answered before decisions are made as to the reopening of the schools and the acceptance of students. But I expect, of course, that all levels of government and parents and institutions look at these different issues before starting to loosen up the rules.
About the framework that you've discussed with the premiers and the modeling numbers that are coming out today, there is another brewing healthcare crisis as well because of all the the elective surgeries, right? So people that are perhaps waiting for important cancer surgery now are very uncertain as to when that could happen. So when you're discussing this with the provinces, you're looking at the modeling numbers. What benchmarks are there to start to reopen those type of important medical procedures that are sort of separate from this COVID-19 epidemic?
That is an extremely important element of any reopening and of our healthcare capacity. Of course, while we are dealing with a massive COVID-19 crisis, there are still people who need surgeries, who are facing difficult treatments, who need to access our healthcare system for other reasons. And that is why part of the frameworks agreed to by the provinces and the federal government includes healthcare system capacity, not just to handle a potential resurgence of COVID-19, but how to handle the regular needs of patients who are dealing with health issues that are not COVID-related. Okay.
We know that even in this period of COVID-19 where we have huge capacity challenges potentially in our healthcare system, we still have people who need some treatments, visits to the hospital, or have emergencies, and we must maintain a capacity for these people. That is why within the principles proposed by the provinces and the federal government as a benchmark for the reopening of the economy, we must make sure that not only there's capacity in the healthcare system to respond to a potential resurgence on COVID-19 front, but also respond to other medical emergencies and treatments that are necessary for the population.
Merci beaucoup.
That is Prime Minister Justin Trudeau outside Rideau Cottage. You might have noticed he held his availability earlier in the day because we are going to see the first virtual sitting of Parliament ever in this country. So history being made very shortly. as we take a look at the nation's capital. And we are joined by Abigail Beeman, who is in Ottawa, who's going to give us some analysis on what was said. Also, we're going to be talking to Tom Vernon, who is in Alberta, Fort McMurray, dealing with a double state of emergency, so to speak, and Reggie Cicchini monitoring the situation for us out of Washington. Abigail, I want to start again with you. A lot of talk about a vaccine today when it came to the Q&A. The other thing that was interesting was the federal guidelines that are coming out today, Abigail, in regards to what provinces need to do. And what I'm curious about is why these are coming out now when we've heard the framework from some provinces already.
That's right. Well, I think it's important for the Prime Minister, from his standpoint, to stress that that Ottawa and the provinces are cooperating, which has been something everybody's been watching throughout this. There has been a high level of cooperation between the provinces and Ottawa, but the Prime Minister said that in his comments today. Of course, they don't always agree, but it's to his own advantage to get ahead of that, to show how the feds and the provinces have been working together. But overall, I found his comments today, it was sort of about a tease about news to come. There wasn't actually a lot that was announced there. He's promising this framework that will be rolled out, and he's also speaking ahead of this modeling that will be rolled out. And as he said, things are that we're doing better, that the curve is flattening, but it's not time to ease up on restrictions. We're not out of the woods just yet, but really we haven't seen that data yet to back up what he was saying, and we haven't seen that framework in terms of this reopening. He was careful to say that this framework was not sort of a roadmap in terms of when things will reopen. It wasn't a calendar in that sense, but rather what needs to happen before things will reopen. And he talked again about how that would be a gradual, careful process based on science.
Abigail, he also spoke, or he was asked directly, twice in fact, about whether he'd be comfortable sending his own children to school in Quebec. We know that Quebec is opening its schools outside of Montreal in 2 weeks, and then a week later inside Montreal. Didn't really answer that.
That's right. And of course, interesting because of his own background as a teacher, not to mention he was asked directly as a parent, and he was asked more than once. And his answer, part of his answer anyway, was that, you know, this is happening in 2 weeks. Speaking as a parent, if he had kids in the Quebec system, he would look at that in 2 weeks' time before this, because this is a rapidly evolving situation. And of course, he said that, you know, everybody involved here, he expects is looking at things carefully before this is being done, and that it's being done carefully, he expects. But he did not directly answer that question or really weigh in on what he thought about schools opening in 2 weeks. And this again goes back to that sometimes provincial Ottawa divide. And he was asked a couple of questions about, you know, provinces that are moving ahead in different ways, each province facing its own unique situation, but each province making its own decision there as well.
Okay, Abigail, thank you for that. I want to bring in Tom Vernon in Alberta. And Tom, you heard the Prime Minister. In fact, he talked about his mom, who's doing well, but then he also talked about the situation in Fort Mac. Give us the latest in what's happening there.
Yeah, so it's been a cool spring here, and the fear was once the weather started to warm up, we'd see a rapid melt and ice jams form, and that's what's happened in Fort McMurray. Pretty bad flooding in that community. The lower part of the community underwater there. 15,000 people have been evacuated. This comes essentially almost exactly 4 years after the wildfire in that community as well. A lot of the areas that were hit by that wildfire are now underwater. The Premier toured the area yesterday and spoke with the mayor up there. We heard that the mayor has asked for military help. Now, that request has to come through the province, so if there is a need for the military to come in to help with sandbags and that, the province says it will put forward that request. It has not been done just yet, but a 25-kilometer long ice jam in Fort McMurray in that area, so not sure when the water will recede, but residents there being hit hard by that in the course of this pandemic, so obviously that is raising concerns there as well.
Yeah, I can't even imagine being told to stay in your home and then having to leave your home. It must be so difficult for the residents there. And let's talk about what's happening at that meat packing plant. Alberta, we know now, has close to 5,000 cases, and a quarter of those are linked to this plant. Do we know what happened there, and what is the latest out of that situation?
Yeah, so the government has received a lot of criticism about that. Workers in that plant had raised concerns about this before the outbreak had really occurred. They say they were working in close conditions. A lot of the people, they carpool, they live in close quarters, and we have seen a huge outbreak. The largest outbreak, as you mentioned, in Canada right now is linked to this meat plant in High River. There's another meat plant in southern Alberta that has a couple hundred cases as well. The opposition here has called for an inquiry into this. The union, we've seen a couple of deaths linked to this. The union has called for a fatality inquiry to find out exactly what happened. The plant is closed. The other one is working on just a single shift. But a lot of concern about that outbreak here. I mean, people say, look, if this had been handled better, we'd have far fewer cases in Alberta. We'd be a lot further along in the fight of this pandemic.
Tom, Alberta's Chief Medical Officer of Health is praising Albertans for keeping the numbers below projections. I know we're getting the national numbers today, but how low are these numbers? How much below? Yeah, so a few weeks ago when the province released its modeling, it figured that at about this time there'd be 400 Albertans in hospital dealing with COVID-19. The number as of yesterday was 87 people. The number of people confirmed cases in Alberta is 18% below the national average. So the Chief Medical Officer of Health here says, look, we're doing a good job. We are containing this. Apart from that meatpacking situation, a lot of the province is doing very well. Now, to be clear, the number of cases is still going up. We saw more than 200 new cases yesterday. We saw 2 more deaths. 75 people have passed away in Alberta. So we're not through it yet, but the Chief Medical Officer of Health says, look, we are bending, or we are at least below where we were expecting to be. Let's keep this up. We aren't talking about opening the economy here yet. We have not seen what those details look like, but as far as where their modeling was projecting, we are ahead of the game here. Well, that's certainly good news. Let's talk about the oil sector while I have you. Companies are going to start releasing their financial results for the first 3 months of the year. Any expectations there, and what do they want from the federal government?
Yeah, it's going to be a difficult time here in Alberta. Even before the pandemic hit, we were under a curtailment program here in Alberta. There simply is not enough pipeline capacity to get the oil produced out of Alberta off to markets. We were seeing low prices here. We were seeing investment being pulled back. And then the pandemic hit, and world oil demand has dropped by upwards of 30 million barrels per day. We saw prices go in the negative. Last week, we saw West Texas Intermediate dip as low as almost $40 per barrel below price. So oil companies here are saying, look, this is going to be a devastating year. There was a report released this morning by Alberta Treasury Branch, a production they put out called The Owl, that says we could see a 14% drop in the number of barrels of oil produced in Alberta this year. That's 176 million barrels fewer than last year. The companies here have said, look, we need support. We need liquidity. A couple weeks ago, the federal government did announce some money for $1 billion for well reclamation. That will keep people working to clean up old wells, orphan wells, wells that aren't in use anymore. But there's a lot of concern about these medium and small businesses not being able to pay the bills, not being able to keep people on staff, and that would just drive them even further into debt and potential bankruptcies. So the numbers, they're not going to be good. It's going to be tough this year, and they're calling for billions more in support of some form from the federal government.
All right, Tom Vernon in Edmonton, thanks so much for joining us this morning. We're going to take a look at where the numbers stand globally and here at home. Let's start in Canada, where almost 50,000 people have tested positive. More than 2,700 people have died. The number worldwide of coronavirus cases is now well over 3 million. Nearly 1/3 of those cases are in the United States. And that is where we go now to the U.S. Here in Canada, provinces are beginning to announce plans for phased reopenings. And in most cases, that's still several weeks away. But in the States, a very different story. Let's bring in our Reggie Cecchini. Reggie, some states are moving forward with strategies to ease restrictions. And this is despite the United States reaching 50,000 deaths and even warnings from the World Health Organization.
Yeah, Farah, this has kind of been a problem that health experts around the U.S. have been fearing, and it started last week when Georgia was the first state to start easing some of those restrictions, allowing people to walk into places like hair salons and tattoo parlors and massage therapy studios, places where it's really difficult to practice social distancing measures. And then on Monday, we saw Georgia essentially flip the switch and allow things like restaurants to officially reopen, and malls are actually going to start reopening as well. And this is something that's now playing out across nearly a third of the country. There are states from the Midwest down through the U.S. South that are very gradually starting to allow business to return to normal, despite the fact that we have health experts saying the more people that are around each other, the greater opportunity there is for this virus to continue to spread. And because of that, we're actually seeing the models be slightly shifted now that the White House has been using. It had showed that a best case scenario in the U.S. for deaths would be around 60,000. It was recently updated to about 64,000. But only in the last 24 hours, that model now shows that the best case scenario is 74,000 deaths by August. And the people who put it together essentially say that it's because peaks are lasting or at least haven't started yet in some states, but also because people are now becoming closer as these states allow restrictions to ease. So it is a problem going forward. And then you lump in the inadequate rollout of testing across the United States. There is a grave concern that sometime later on this year, there could be a second pop-up of this virus right across the country.
I was going to ask you about that next. Testing. The president is facing added pressure to increase testing. We know testing and contact tracing is so key when we're talking about opening up economies. How bad is the testing there, or lack of?
Well, look, testing has been an issue from the beginning across the United States. The federal government really didn't lay out any kind of national testing strategy and essentially put that on the states' shoulders to carry. And we've seen that through now, only 5 million Americans have actually been tested, and that works out to less than 2% of the entire U.S. population. And health experts and epidemiologists have been saying that in order to get the country back to essentially pre-pandemic levels, states need to be testing tens of thousands and up towards 1 million per day, and that simply isn't happening. So what we saw yesterday was the administration put out a plan that was essentially a two-part plan. One had 8 points of responsibility, 7 of those the administration saying that they've already accomplished. It was a series of buzzwords like mobilize and identify, and then essentially that 8th responsibility was telling the states that they now need to work in conjunction with the private sector to be able to carry out more testing, and that the federal government would simply be the last resort. We've heard now that Washington is going to give each state essentially enough test kits to carry out on 2% of each state's population. And then the states will have to go about their own way of funding and developing testing beyond that. But we've heard fights now for weeks now between governors and Washington to simply say they don't have the resources, they don't have the funding to be able to put these test kits together, and that labs don't have the ability to carry out as many tests as need to be done in order to kind of return to that sense of normal. So we could end up in this situation where states are now bidding against each other for equipment and then going to bid against the federal government to get that needed test supply as well. So it's that back and forth we've been seeing for the last several weeks. Essentially, this plan that we're hearing from Washington is a way to deflect the burden from their own shortcomings when it comes to this testing rollout and simply put it on an overburdened state whose healthcare systems simply may not be able to deal with this.
Are there going to be any accountability sessions for the president? You know, today here we have our politicians meeting virtually for the first time. How is that all working? How is the opposition kind of holding the president to account right now on what's happening there?
Well, look, it's kind of a back and forth between what the president says, what Congress says, and then what the media is reporting. And that's why we get a lot of mixed messaging in the United States. President Trump, you know, as we heard last week, oftentimes will get ahead of anybody to try and get a message across that oftentimes needs to be walked back either by the medical experts or by the political leaders. You were talking about how Parliament is going to be meeting virtually. We've now found out within the last half hour or so that the U.S. Congress, which was supposed to return next week, is simply not going to return, despite the fact that there is pending legislation to try and get additional funding brought out to the American people. So it's now a question as to when U.S. lawmakers are going to be able to return to work. But right now, the president simply uses his daily press briefings as a way to get the message across. And then he's essentially left up to the media to try and fact check him. And now that that's been happening kind of in a negative way over the last few days, we've seen the president start to pull back. He didn't hold a press briefing over the weekend. He held a last-minute one last night, which is where we got this kind of new guidance for testing. And then we found out that he's not going to be holding a press briefing today. They're apparently going to be retooled to allow these daily briefings to take on more of an economic messaging as opposed to medical messaging. But it makes it much more difficult to actually kind of try and figure out what the president is doing here and where the responsibility lies, because oftentimes we've heard the president say he doesn't take responsibility for anything, whether it's the number of deaths that are occurring in the U.S. or whether it's that lackluster testing that's taking place, and he simply places that blame either on state leaders or he places it on former administrations.
How do the rules stand, though? Because he was saying, in front of everybody that he's telling Georgia to not go so quick in the way that they're doing things. But where, I guess, who makes the last call on things like that? If there was a state that was opening and he felt that it shouldn't open, does he have the power, or is it like here where the provinces have the power?
Well, look, the president has said numerous times in the past that he has absolute power, which simply isn't the case across the U.S. It's left up to the governors. The president put out these guidelines that are to explain to states how they're supposed to reopen, but it's simply just kind of granular guidance, and each state gets to make their own rules, which is why we see certain states officially unlocking all businesses, and other states like California and New York, which are working very closely with other governors to try and ensure that it is a much more phased approach.
Well, we will see how this all plays out, and we do have an election, right, later on this year. Okay, thank you, Reggie Cicchini, for that. I just want to give everyone at home a recap of what we heard from Ottawa today, since we spent a little time in the United States right now. The Prime Minister mentioned new modelling is coming out in just minutes. He says the measures we're taking so far are working. That's the bottom line in this. And many parts of the country has the curve flattening. But he also said we're far from out of the woods. He also promised federal guidelines for reopening economies, and that's coming shortly. Trudeau also said several shipments of personal protective equipment are being received every week. In terms of numbers, 6 million surgical masks will be shipped to provinces and territories this week. We have more coverage on our website, globalnews.ca. Now to your regularly scheduled programming.
Hello, everyone. Bonjour à toutes.
Bonjour à tous.
I'm just going to start, as usual, with
Morning,
the latest
everyone.
numbers of COVID-19 in Canada. There are now 49,025 confirmed cases, including 2,766 deaths. To date, labs across Canada have tested over 740,000 people for COVID-19, with about 7% of these testing positive. Over 20,000 people have been tested daily, as provinces and territories continue to increase testing capacity.
Bonjour. Good morning. Let's start with the latest figures across Canada. Today, there are 49,025 confirmed cases, including 2,766 deaths. To date, laboratories throughout the country have carried out over 740,000 tests, and about 7% of these have turned out positive. The provinces and territories continue to increase their testing capacity, and over 20,000 people have been getting tested every day for the past week.
Slide 2. Earlier this month, we shared our forward projections and the potential resulting impacts on the healthcare system. Today, we will present an update on our previous projections and discuss the implications for moving forward. As I have said before, models are planning tools. They allow us to forecast infection and illness rates in the short term and to explore the effectiveness of different combinations and timing of public health measures to control the epidemic.
Diapositive 2. Slide 2. Earlier this month, we shared our forward projections and the potential resulting impacts on the healthcare system. Today, we will present an update on our previous projections and discuss their implications for moving forward. As we've said before, models are planning tools. They allow us to forecast infection and illness rates in the short term and to explore the effectiveness of different combinations and timing of public health measures to control the epidemic.
Slide 3. As a reminder, our strategy is twofold: to control the epidemic by reducing transmission through public health measures, pushing that blue curve down, and to prepare our health system to meet increased demand by raising up the dotted red line of healthcare capacity.
Diapositive 3. Slide 3. We remind you that our strategy is twofold: to control the epidemic by reducing transmission through public health measures, pushing the blue curve down, and secondly, to prepare our health system to meet increased demand, raising up the dotted red line of healthcare capacity.
Slide 4. In order for the epidemic to die out, we need to get to the point where each infected individual is only transmitting the virus to less than one other person, which is one of the primary objectives of all of our public health measures. Prior to implementing public health control measures in March, we estimated that each infected person passed the virus onto an average of just over 2 additional people. Today, stronger controls, including physical distancing, increased testing to identify and isolate cases, and trace and quarantine contacts are helping to reduce the average number of people each case infects to just above 1.
Diapositive 4.
Slide 4. In order for the epidemic to die out, we need to get to the point where each infected individual is only transmitting the virus to less than one other person, which is one of the primary objectives of all our public health measures. Prior to implementing public health control measures in March, we estimated that each infected person passed the virus to, on average, just over 2 additional people. Today, stronger controls, including physical distancing, increased testing to identify and isolate cases and trace and quarantine contacts are helping to reduce the average number of people each case infects to just above 1.
Slide 5. So I will now provide an update on the epidemiology of COVID-19 in Canada. Slide 6. The epidemiologic picture in Canada continues to highlight regional differences, with our 2 largest provinces, Ontario and Quebec, representing more than 80% of all confirmed cases. British Columbia and Alberta are the next most affected provinces, accounting for 14% of confirmed cases. Elsewhere, case counts are lower, but all provinces and territories, with the exception of Nunavut, have reported cases. Confirmed case counts have more than doubled since April the 9th modelling briefing. This increase is largely attributable to increases reported in Quebec, Ontario, Alberta, British Columbia, and Nova Scotia. The proportion of cases who have died has increased from 2.2% on April the 9th to 5.5% as of April the 27th. It is expected that the case fatality ratio will continue to change over time. Based on available information, 17% of cases have required hospitalization, and less than 5% have required intensive care.
Diapositive 5.
Slide 5. First, we will provide an update on the epidemiology of the COVID-19 pandemic in Canada. Slide 6. The epidemiological picture in Canada continues to highlight regional differences, with our 2 largest provinces, Ontario and Quebec, representing more than 80% of all confirmed cases. British Columbia and Alberta are the next most affected provinces, accounting for 14% of confirmed cases. Elsewhere, case counts are lower, but all provinces and territories, with the exception of Nunavut, have reported cases. Confirmed cases counts have more than doubled since the April 9th modelling briefing. This increase is largely attributable to increase reported in Quebec, Ontario, Alberta, British Columbia, and Nova Scotia. The proportion of cases who have died has increased from 2.2% on April 9th to 5.5% as of April 27th. It is expected that the case fatality ratio will continue to change over time. Based on available information, 17% of cases have required hospitalization, and less than 5% have required intensive care.
Slide 7. Based on available information, some individuals are at increased risk of severe illness depending on age, gender, and underlying health status. Adults aged 60 years and older account for 95% of deaths. While only 45% of reported cases are male, males are more likely to be admitted to the hospital and the ICU. Almost 3/4 of cases with information available reported one or more pre-existing health conditions. However, no one is immune to severe outcomes of COVID-19.
Slide 7. Based on available information, some individuals are at increased risk of severe illness depending on age, gender, and underlying health status. Adults age 60 years and older account for 95% of deaths. While only 45% of reported cases are male, males are more likely to be admitted to the hospital and the ICU. Almost 3/4 of cases with information available reported one or more pre-existing health condition. However, no one is immune to severe outcomes of COVID-19.
Slide 8. Canada has several regional epidemics as shown here. Many factors, such as differences in subpopulations affected and laboratory testing, contribute to these regional trends. We are observing slowed epidemic growth and a leveling off of epidemic trajectories across most jurisdictions in Canada.
Slide 8. Canada has several regional epidemics, as shown here. Many factors, such as differences in subpopulations affected and laboratory testing, contribute to these regional trends. We are observing slowed epidemic growth and a leveling off of epidemic trajectories across most jurisdictions in Canada.
Slide 9. Outbreaks in high-risk populations are the driving force behind the regional epidemics. In particular, outbreaks in long-term care and seniors' homes are driving epidemic growth in Quebec, Ontario, and Nova Scotia currently, and are responsible for the majority of all deaths in Canada. Outbreaks in other congregate living and work settings are also driving case counts in some provinces. These settings include shelters, correctional facilities, and food and agricultural work settings with congregate housing for employees.
Slide 9. Outbreaks in high-risk populations are a driving force behind the regional epidemics. In particular, outbreaks in long-term care and seniors' homes are driving epidemic growth in Quebec, Ontario, and Nova Scotia currently, and are responsible for the majority, that is 79% of all deaths in Canada. Outbreaks in other congregate living and work settings are also driving case counts in some provinces. These settings include shelters, correctional facilities, and food and agricultural work settings with congregate housing for employees.
Slide 10. This slide compares how fast the epidemic is growing in several countries. For comparison purposes, country curves are aligned at day 0, the day the country reached its first 500 cases. Countries whose epidemics began earlier were chosen for this comparison. Canada's epidemic, the red curve, is at a somewhat earlier stage, hence the Canada line is shorter. Canada's epidemic slope is bending as the rate of growth slows down in response to our collective control efforts. Canada's total case counts continue to increase more slowly than most countries. Last time I presented this graph to you, Canada's confirmed case count was doubling every 3 to 5 days. At this time, the number of cases is doubling at a rate of every 16 days.
Slide 10. This slide compares how fast the epidemic is growing in several countries. For comparison purposes, country curves are aligned at day 0, the day the country reached its first 500 cases. Countries whose epidemics began earlier were chosen for this comparison. Canada's epidemic, the red curve, is at a somewhat earlier stage, hence the Canada line is shorter. Canada's epidemic slope is bending as the rate of growth slows down in response to our collective control efforts. Canada's total case counts continue to increase more slowly than most other countries. Last time I presented this graph to you, Canada's confirmed case count was doubling every 3 to 5 days. At this time, the number of cases is doubling at every 16 days.
Slide 11, now we're looking at some modeling scenarios. Slide 12. It is important to recognize that models are not crystal balls and cannot predict what will happen. What models provide is a prediction of what could happen under various hypothetical scenarios to allow us to prepare for a worst-case scenario and to drive our public health actions towards a best possible outcome. Nationally, we are using two modeling approaches, forecasting and dynamic models. Forecasting models use actual data on the cases being reported over time in Canada to estimate forward on how many new cases we might expect in the coming week. Dynamic models don't use real-life case data, yet are useful in that they permit a longer-term view based on our knowledge of how the virus behaves. This helps us to visualize potential epidemic growth scenarios and impact of control measures that mitigate growth over time.
Slide 11, modeling scenarios. Slide 12. It is important to recognize that models are not a crystal ball and cannot predict what will happen. What models provide is a prediction of what could happen under various hypothetical scenarios to allow us to prepare for a worst-case scenario and to drive our public health actions toward a possible best outcome. Nationally, we are using two modeling approaches, forecasting and dynamic models. Forecasting models use actual data on the cases being reported over time in Canada to estimate forward on how many new cases we might expect in the coming week. Dynamic models don't use real-life case data, yet are useful in that they permit a longer-term view based on our knowledge of how the virus behaves. This helps us to visualize potential epidemic growth scenarios and impact of control measures that mitigate growth over time.
Slide 13. This slide illustrates possible trajectories generated by a forecasting model that uses real Canadian case data. The graph on the left shows the predicted number of COVID-19 cases could be in the range of 53,000 to 67,000 cases by May the 5th. The graph on the right, which is new, shows the predicted number of deaths due to COVID-19 could be in the range of 3,300 to 3,900 by May the 5th. Due to changes in the epidemiology of COVID-19 in Canada, including outbreaks in high-risk settings, the initial modelling projections on April the 9th underpredicted the number of deaths. This was because a lower general population case fatality ratio was used in the model that we had at the time. But with a large number of outbreaks occurring in long-term care homes, the actual case fatality rate was higher than the modelling scenario. The models have been adjusted with a higher case fatality rate, and we will continue to make adjustments to these forecasting models over time based on real data. Right now, we are seeing the tragic paradox of the epidemic playing out. As the epidemic comes under control and the growth of cases slows, the severe outcomes and deaths continue to accrue as COVID-19 takes a heavy toll among highly susceptible populations.
Slide 13. This slide illustrates possible trajectories generated by a forecasting model that uses real Canadian case data. The graph on the left shows that the predicted number of COVID-19 cases could be in the range of 53,000 to 67,000 cases by May 5th. The graph on the right shows that the predicted number of deaths due to COVID-19 could be in the range of 3,300 to 3,900 by May 5th. Due to changes in the epidemiology of COVID-19 in Canada, including outbreaks in high-risk settings, the initial modelling projections on April 9th underpredicted the number of deaths. This was because a lower general population case fatality rate was used in the model that we had at the time. But with a large number of outbreaks occurring in long-term care homes, the actual case fatality rate was higher than the modeling scenario. The models have been adjusted with the higher case fatality rate, and we will continue to make adjustments to these forecasting models over time based on real data. Right now, we are seeing the tragic paradox of the epidemic playing out. As the epidemic comes under control and the growth of cases slows, the severe outcomes and deaths continue to accrue as COVID-19 takes a heavy toll among highly susceptible populations.
Slide 14. You are now familiar with this graph and concepts showing the potential impact of our public health measures on the size and duration of the epidemic wave. This slide illustrates the three possible scenarios we use for planning. The red curve for the sharp high peak represents the no controls or worst case scenario, where the majority of the population could be infected over a relatively short period of time. The blue line curve shows a scenario where weaker epidemic controls have been implemented to delay and reduce the height of the peak. The green smaller curve represents a best case scenario in which we implement strong public health measures to reach our objective of epidemic control. This is the scenario we are currently working towards, where each infected person only transmits to less than one other person. To stay on this green best case scenario curve, we must achieve and maintain a high degree of physical distancing while also maintaining a high rate of case detection and isolation and contact tracing and quarantine.
Diapositive 14.
Slide 14. You are now familiar with this graph and concept showing the potential impact of our public health measures on the size and duration of the epidemic wave. This slide illustrates the three possible scenarios we used for planning. The red curve with the sharp, high peak represents the no controls or worst case scenario, where the majority of the population could be infected over a relatively short period of time. The blue line curve illustrates a scenario where weaker epidemic controls have been implemented to delay and reduce the height of the peak. The green smaller curve represents a best-case scenario in which we implement strong public health measures to reach our objectives of epidemic control. This is the scenario we are currently working towards, where each person infected only transmits to less than one other person. To stay on this green best-case scenario curve, we must achieve and maintain a high degree of physical distancing while also maintaining a high rate of case detection and isolation and contact tracing and quarantine.
Slide 15. All jurisdictions are working towards epidemic control. However, it is critical to remember that once we are on the downside of the slope, we must absolutely remain vigilant and continue our public health measures. By achieving epidemic control, we expect that only a small proportion of the population will be immune. So, until the population has developed a high level of immunity to the virus, or we have a vaccine in place, we have to plan to live with a manageable level of COVID-19 activity. Therefore, we anticipate that some public health measures will need to remain in place to prevent the sparking and growth of future epidemic waves.
Diapositive 15. Toutes les administrations s'efforcent de maîtriser l'épidémie. Il ne faut toutefois pas oublier que, une fois que nous serons sur la pente descendante, nous devrons à tout prix rester vigilants et poursuivre nos mesures de santé publique. En maîtrisant l'épidémie, nous nous attendons à ce que seule une faible proportion
We expect that only a small proportion of the population will be immune. So until the population has developed a high level of immunity to the virus, or we have a vaccine in place, we have to plan to live with a manageable level of COVID-19 activity. Therefore, we anticipate that some public health measures will need to remain in place to prevent the sparking and growth of future epidemic waves.
Slide 16. We continue to monitor the situation closely and will evaluate, learn, and adapt as we go. We are making clear progress to slow the spread and bring the epidemic under control, thanks to the commitment of Canadians who are following public health advice to protect themselves and others. The epidemiology of COVID-19 is not the same in all parts of the country, so when and how control measures are readjusted and or relaxed will need to be decided based on the local epidemiologic situation. It is critically important that we maintain our public health measures, including physical distancing, until we have achieved epidemic control for the first wave. Relaxing controls too quickly will squander our collective efforts to date and put us at risk of future epidemic waves. Thank you.
Slide 16, summary. We continue to monitor the situation closely and will evaluate, learn, and adapt as we go. We are making clear progress to slow the spread and bring the epidemic under control thanks to the commitment of Canadians who are following public health advice to protect themselves and others. The epidemiology of COVID-19 is not the same in all parts of the country. So when and how control measures are readjusted or relaxed will need to be decided based on the local epidemic situation. It is critically important that we maintain our public health measures, including physical distancing, until we have achieved epidemic control for the first wave. Relaxing controls too quickly could squander our collective efforts to date and put us at risk of future epidemic waves. Thank you.
Thank you, doctors. We will now open the line and the floor to questions. As usual, we will start with 3 questions from the phone and then 3 questions from the room. Vous pouvez poser vos questions dans l'une des deux langues officielles.
You can put your questions in either official language.
Limit yourself to 1 question, 1 follow-up. For those asking questions in the room, we ask that you make your way over to the freestanding mics. Operator Eric, over to you.
Thank you. If you have a question, please press star 1 on your telephone keypad. Si vous avez une question,
if you have a question, please press star on your touchtone keyboard.
Is from Lina Dib de la Presse Canadienne. La parole est à vous.
You have the mic. Question. Thank you. I see in the annexes that nothing has changed in the long-term forecasts and the total number of deaths and the total number of cases. Can you explain why that wasn't adjusted in the same way that you adjusted your short-term predictions until May 5th? This is Dr. New. Thank you for the question. Answer. The slides are still in force because in the last slide we evaluated the possibilities if the infection rate is 1%, 2%, etc. That hasn't changed because we continue with our best efforts to have the lowest infection rate possible. But in the short term, given the data and the cases we have already, we can do a short-term projection. But long-term projections, this remains in place. Question. Okay. Am I to understand then that right now we're at the minimum, we're at the 2.5% scenario? 2.5% is infected? And my other question is, you said that in the future, a person could infect at most one person. So what do you mean exactly? 1.1? One that infects 2 point something compared to one who infects 1 point something? Yes, I think if you're talking about the slide on page 20, here in Canada right now, we are in the green zone. We can't give you an exact figure about the percentage of the population that's infected because we don't know if we're at the end of the first wave. And perhaps for the total epidemic, it's different. Question, but we know it won't be 1% because it's 4,000 people. You're talking about 3,800. Yes. Answer, yes, but this is always evolving. We can't always reach conclusions after the first wave in total, because it depends what will happen in the next few waves. But concerning your question about the number of people that an infected person can infect in turn, at the beginning, yes, it was a little more than 2 people, 2 point something. It's very difficult to be more precise. We know that it's slightly more than 1 person. That's not great, but it's better. The objective is to have 1 person infecting less than 1 other person. That means that we can finally stop these outbreaks here in Canada.
Merci. La question suivante. The next question is from Laura Osmond with the Canadian Press. Please go ahead. La parole est à vous.
Thank you. I had a question about the case fatality count in the long-term dynamic scenarios. Should those be adjusted long-term? Can we expect to see more deaths, even in the best-case scenario, based on the new case fatality rate?
So I think Dr. New said in French, actually, we don't know what the final outcome is yet. We are still on that first wave. And these projections are actually for essentially over the course of the pandemic itself. Until the epidemic is over, you actually don't know the true case fatality rate as the denominator and the numerators, it changes over time. So these are kind of dynamic, but until you actually get to the bottom of the epidemic, you actually don't know. So right now, of course, we think we're in that green zone. If you just look at the deaths, but we haven't got to the final outcome. So that's why exactly what we're aiming for, and we believe that we're staying within that zone.
Thank you, Doctor. Follow-up?
Can we expect that the shape of that green curve to change dramatically over the next couple of weeks as provinces start to talk about carefully lifting their restrictions?
So I think this is the projection as of now. I think all provinces and territories trying very hard to bring any outbreaks under control, to put in place these preventive measures. I think when we see the virus going into a susceptible population, then it could still get higher, is possible. But again, these curves we adjusted. If you see that curve itself, the graph on the right on slide 13, the further out you go in terms of from when we did the projection, the curves widen because the actual uncertainty and the spread and the range increases over time. Just because every day out from the estimate, your level of certainty decreases and those curves start spreading wider apart. But that's the range that we are forecasting at this point in time.
Thank you, Dr. Tam. Operator?
Thank you. The next question, la question suivante est de Marie.
The next question is from Marie Vastel of Le Devoir.
Please go ahead.
You have the floor. Please go ahead.
Dr. Tam, I'm going to circle back to the previous question. In terms of the slide at the last slide, in terms of the projected long-term deaths, depending on the percentage of the population that would be infected, I'm having a hard time understanding why the death rate isn't higher, given that you just said in the beginning that your short-term death projection had to be reviewed because we've seen more deaths in long-term care residences. So if we've already had a higher death rate, how come the long-term death rate isn't increased to take that into account? Does that make sense?
Yes, I think you do, and I think for the purposes of planning, I think we are staying within that zone. But yeah, I mean, models do have to be adjusted over time, so some of these assumptions can be adjusted over time. But I think for our planning purposes, these three different scenarios are still useful at this moment in time. But you're absolutely right. I think we will essentially be adjusting as we go as well, even on the longer term. But I think, no, this is the nature of models. But I think for planning purposes, right now, we're just sticking with these three scenarios.
Yeah, it's Dr. New. Maybe I would just add to that is that if you look at that last slide and the scenarios, the green zone, the blue zone, and so on, I think a lot of it is also based on the experience that we've seen in other countries with sort of an overall sort of a projected mortality rate. Certainly right now, as of the moment, our death rate is higher because we all understand what's been happening in long-term care facilities, et cetera. But if we obviously collectively do a better job down the road, then you might see that overall, as the overall pandemic sort of unfolds, and at the very end of the day, when, as Dr. Tam said, you can more accurately calculate a case fatality rate, it may be closer to what maybe the experience that we're seeing in other countries and so on. So like Dr. Tam and I've said, models are useful as a tool for planning purposes, but they're certainly not the crystal ball that will exactly tell you how many people will be hospitalized or end up dying at the end of the day.
Merci, Dr. New. Marie?
Thank you, Dr. New. Follow-up? Yes,
and
thank
then
you.
if we go back to the
Question.
short term, then I understand that the more you progress, the wider the projections are, but it is only in a week. So if you look at the situation right now, the death rate that we are seeing for the past few days overall in the country, right now is your curve closer to the red curve of slide 13, or are we tending closer to the green curve? In other words, right now with what we're seeing in the past few days in terms of death rates per day or cases per day, where do you see the curve going most likely? Or is it the black curve in the middle?
It's maybe it's Dr. New. I'll start off and hand it over to Dr. Tam. As we've said, is that the reason we only want to give, let's say, short-term projections is because of that the level of uncertainty. The farther out you go, and as you can see here, based on the model, sort of the projections by our experts, what we talk about usually in epidemiology and modeling is what we call a 95% confidence interval, and you can see that's why we have quote the upper and lower limit, and so in the middle is sort of where we think we're tracking, and we have that quote upper limit and lower limit in terms of the confidence limits. But you're right, we have to actually see what unfolds over the coming days. The other point I think we've made repeatedly is that if you're looking at deaths, etc., it's kind of hard to look at predictions because they really are the result in many ways of activities, what the general population, what was happening in long-term care facilities sort of like 2 or 3 weeks ago, obviously, because, by the time the incubation period, unfolds and testing, et cetera, and so on. So obviously what we do today will have a direct impact on what we see in terms of the actual data 2 to 3 weeks out from now. So that I think is an important point to underline. Dr. Tam?
Maybe I'll just suggest those with better eyes than me on a tiny piece of paper right now. If you looked at today's date, I think and we just indicated that we had 2,766 deaths. It is trending within the line of prediction. And so if you just went across this graph a couple of days from the last time we checked in on the data, it is trending as this particular curve and within that range. So we will see in the next few days what happens.
Thank you, doctors. Now we will go in the room. Stevie?
Hi, thank you very much for doing this today. You've said that 79% of deaths have been tied to long-term care facilities, and the deaths have only gone up since the federal government released its previous modeling a few weeks ago. What did the new model show about how effective the various measures have been to try to control outbreaks in long-term care homes and seniors' homes? And as well, how many of the overall deaths in today's models will be tied to long-term care facilities?
Again, whatever we do today will result in the sort of final picture that we're going to see. And so working really, really hard in getting outbreaks under controls, not just in the long-term care homes, but some of the other settings that are also laid out in that slide, including the persons who have experiencing homelessness. Some of correctional institutes and others are really important right now. So I think what we do now to get those settings prepared will eventually influence the final picture for sure. I think, though, if you looked at the various composite amount of information we gave you, is that it is really slowing down. The doubling of the cases went from about 3 to 5 days the last time we spoke to now closer to every 16. And the epidemic is slowing down in the different provinces and territories. But the data that we present at the national level, I think there was a question about, where that effective reproduction number is at. What we're showing you is a composite picture. What you will see that in some jurisdictions, they actually haven't had community transmission. Their R is going to be under 1. And others are still working at this, some of the bigger provinces, as they are working really hard at getting some of the clusters under control. I think in our discussion with chief medical officers, we're also trying to look at the epidemiology itself, because the transmission dynamics inside a relatively confined cluster is different than looking at general community transmission as well. So that kind of epidemiology provinces will take into account as they look at when and how they're going to relax some of the measures.
Follow up?
Yes. Ontario and Quebec represent about 80% of confirmed cases. And given that it appears there's no leveling off right now in either province, do you believe it's too early for the premiers and those governments to be considering lifting restrictions and even considering opening schools and industries?
Well, I think in all jurisdictions, including Ontario and Quebec, things are slowing down despite the fact that, of course, we're still seeing cases and they are all working really hard. I think it is important to collectively plan forwards. And so with Chief Medical Officer of Health, we collaborated on looking at the common criteria, some of which are very much reflected in what the provinces have spoken to, like Ontario, for example, looking at getting the epidemic under control, making sure you have the public health capacity in place for testing as well as contact tracing and case isolation and quarantine, as well as ensuring that your health care surge capacity is still there. And so all of those kind of factors go into the way that they make the decisions as well. So we are also collectively looking at when the time is right for each jurisdiction, what some of those initial measures could be in terms of easing back some of those public health measures. And certainly educational settings, including schools, are very much part of that discussion, including the fact that even with limited evidence, the graph that we showed you show that the younger populations don't experience the severe illness as much as those persons over the age of 60. So that's part of the considerations, I think, in terms of safe return of kids to school. I think what we are really happy to see is that every jurisdiction have said that we really need to move cautiously. So you may want to start with some schools in an area that isn't really in the hot zone. And then you progressively monitor what happens, and then you gradually ease back certain other settings as well. So I see that all provinces are really sort of aligned with some of those public health criteria, and that they are moving cautiously through those plans. So I think planning is actually important for work settings as well. I think Chief Medical Officers have said, here are some public health parameters, but we need different work settings and sectors who knows their own workplace really well to see if they can come up with the kind of plans that are needed in preparation for when the time is right.
Yeah, it's Dr. New, maybe I can just add to that, certainly the authorities in each of the provinces and territories they're closer to the ground than obviously we are at the federal level. So they have more data to work with, and you know exactly what's been happening in their jurisdiction. So I'll pick the province of Quebec as an example. We all know that the tragedy that's unfolding in their long-term care facilities. So certainly the efforts there are they're doubling and redoubling it, looking at testing residents and staff and so on and so forth. So that's a special situation. But then if you look at, quote, the rest of the general population, that's also depending on the region. So certainly Montreal is a hotspot. And so what they may wish to do in Montreal, even in terms of opening schools and so on, may be to a different schedule or rhythm that they may consider in other parts of the province. Also to add what Dr. Tam said, that all of us, including obviously our counterparts in Quebec and the other provinces, are looking at the scientific evidence and seeing how it's evolving. And in terms of the children, it's very interesting. There is limited data out there, but we're looking at it carefully. As Dr. Tam said, it appears that children in general have milder symptoms, obviously, compared to older adults. Another point that's interesting is based on some of the evidence we looked at, the children also don't seem to be sort of major transmitters or responsible for the propagation. So all those types of evidence and what we have in terms of the data is certainly, I think, being an important part of the considerations that all public health authorities in each of the provinces and territories are looking at. Thank you.
Thank you, Dr. Tam. And Dr. New, Toronto Star?
Good morning. Dr. Tam, can you help me understand? So a lot of this looks a lot like what you presented April 9th. And the assumption in the graph on the page 14 suggests that you see, again, 1 to 10% of the population infected with strong controls, which we have now. And you see it peaking in the summer and then petering out by the fall. I'm just curious if you can help me understand, first of all, what's the number of the population? Is that the 10% we see on page 21? You see that up to 10%, 3.7 million. Under your scenario, that would peter out by the fall, would be infected. And I'm curious if that's then what you're projecting. I don't understand how you see the epidemic petering out when you yourself have cautioned against any assumptions about herd immunity by then, and we won't have a vaccine by then. We won't, so help me understand what you're saying there.
So these are just planning scenarios.
But you must have numbers, right? You have actual numbers.
So these are the tables that you see in, I think, in the annex. And the green, the blue, and the red correspond to those numbers. And these, the 1 to 10% in the green bars at the back is what you will sort of project as being under that green curve, and the blue one and the red one, for example, and the attack rates that have been, indicated on slide 14. Those are the numbers that are being displayed in that table, and you can certainly refer to that. And we don't have no control, so I think that can be put aside. We are trying to, of course, working very hard, and I think we are staying in that green zone. This is for the course of the pandemic, and you're right in that, the following slide shows that epidemic could result in further, because there's no. We have to do some of the serologic investigations to know what the underlying proportion of the population infected is. But it's very likely that we don't have that high level of immunity. So when we discuss across the country with the chief medical officers, that is the assumption that we have to maintain a certain level of public health measures, have to be really careful, and we are actually going to be living with COVID-19 for the near future and monitoring very carefully so that if there's any upswing, that any cases and contacts have to be identified and managed so that you don't get that upswing again. Now, I have to say that some of the modeling work going on right now with the dynamic models they're basically showing what will happen if we didn't achieve epidemic control and didn't have effective public health measures in place when we begin to ease some of these measures, is that we could see a second wave that is even bigger than the first. So everything is dependent on what we're doing right now. So if we do everything that we're doing right now and maintaining and easing through things really slowly and cautiously, we can get to the bottom of that initial wave. But even then, you have to be extremely careful about what is going to happen. And so, and different shifts, and if you don't detect those cases and manage them really fast, that's when you could potentially get that second wave. So I think conceptually that's what slide 15 is trying to say, is that we've got to keep going with our measures.
Yeah, it's Dr. Newman. I would just add to that. Certainly, Dr. Tam and myself, we're not thinking that, as you said, that the epidemic or pandemic is going to peter out in Canada. With all of our collective efforts, we're flattening the curve, and we're certainly hopeful that we're hopefully close to, or if not, getting towards the downside of that first wave. But there are a couple of things that certainly will be in play as we move forward. Certainly, the basic core principles in terms of good physical distancing, people maintaining that, the hand washing, the cough etiquette, all those basic things will still be in play. And of course, as Dr. Tam has also mentioned, each of the provinces and territories, if they're considering in terms of what they might want to do in terms of maybe loosening or relaxing some of the public health measures, you have to assure you have a good surveillance system, good laboratory capacity, public health system that's in place to be able to rapidly detect, isolate cases and so on, so that you are able to see if the measures are maybe not having any intended effect. And then as well, you need to make sure that you have the hospital capacity, should there be an upswing in cases, that you're able to accommodate patients that come in and so on and so forth. So there's lots of things in play that all of the chief MOHs are looking at. And certainly what we're looking at is not that after the first wave where we're in the clear. We're anticipating a second, third, who knows how many waves. But we're trying to find a manageable level in terms of, as you say, opening up the economy, relaxing measures so people can go outdoors, but with a manageable level of a certain, I guess, COVID-19 activity that we sort of percolating, I guess, in the general population. each province and territory is different in terms of their own context, what the issues are in terms of how it's being transmitted within key subpopulations, long-term care facilities, etc. So those are some of the considerations that obviously each of the Chief Medical Officers of Health, as well as ourselves on our Special Advisory Committee, are discussing on a daily basis.
Can you confirm then, based on what I'm seeing here, it looks a lot like what you released before. So it's not an actual model. You haven't provided your input data, your methodology, the reproduction number you assumed. This is a synopsis of modeling that the department has done based on a bunch of different Canadian and international experts you've consulted. Is that correct? And if it is, to what extent do you have any concerns about what you're looking at in your planning scenarios when you're only working with less than 60%, it seems, of case data to work with to make your numbers on hospitalization and ICU? Maybe you can clarify some of that. I still don't quite understand why you're not releasing actual mathematical models done by your agency.
Yes, so we know that you have to use a whole suite of models depending on the question that you're trying to answer. So I think it is actually really great that we're consulting across the country with many different academics and experts. Some of the methods that we're using have already been published, of course. And in the annex slide, you'll see some of the references, for example, to the Imperial College London assumptions, and they can be adjusted. But I think that different models are there to answer different questions. This one, which takes into account a range of different published data, provides what we feel to be still reasonable as planning assumptions. So I think there is no a single universal model that's going to take care of everything. You're going to have to use a suite of methods and models, and according to the question that you're trying to answer and what kind of planning you're trying to do. In a provincial level, they do a deeper dive on the ICUs, for example, and those, because operationally it's important for them to know based on their capacity whether they're reaching their capacity or not. So that's a different kind of model, but they use different ranges of assumptions. And so I think, we welcome any, published models as well in Canada that I think, but the majority of them, I have to say, is any dynamic model is saying that you got to keep those public health measures. Anything that you're doing, which isn't slowly and cautiously, can result in a resurgence, and that we might expect to be able to have to deal with some subsequent waves. So I think no matter which modeling you look at, modelers will agree that that is the extreme caution that we are messaging right now. But Canadians have done really well today. Our healthcare system is coping. So we just have to keep up with the great work that you're all contributing to.
It's actually, maybe I just add a quick point you mentioned about the data. And I will say that if you look at the models, obviously there's more data. They're closer to the ground in the provinces and territories in terms of what they're able to project based on the data they have. It is, to be honest, I would be the first to admit it, a bit of a weakness in terms of our collective system. The fact that at the federal level, our national level, we only get a certain percentage of the data. It's not because of a lack of goodwill and that the provinces and territories don't want to give us their data, but there are some challenges, issues, infrastructure, and so on. And I think, obviously, it's a good representation. We're all working together, I think, really well. And I think in the future, to be quite honest, those are things we need to look at in terms of how data is managed, how data is collected, transferred even at local level to provincial level, and then to the federal level. So those are things that we need to look at improving in the future.
Thank you. We'll be taking one last question. Globe and Mail.
Marika Walsh with the Globe and Mail. I have one question and one follow-up. You say we're in the green zone right now, so pretty low case rates. You mentioned in your opening remarks that means that low infection means that there's a higher proportion of people still open for infection later. So what does that mean for the measures? Does that mean that until we have better treatment or a vaccine, we will have this physical distancing in place at a certain level? And if we will maintain some physical distancing until that point, what is that physical distancing?
So that's, I think, you grasp the concept that, it's likely that a significant proportion of our population is not immune. We're in the immunity task force that we talked about earlier this week. Some of the serological studies are going to try and answer some of those questions in looking at different parts of the population and the level of immunity or the level of infection, at least exposure to the virus. We still actually have to study the immunological response to the virus and how people develop immunity and how long they last for over time. So it's quite a dynamic piece that actually hasn't really been answered yet. So those questions will remain, which means you're right, that we will not go back to what life will be like before January of this year. Public health authorities will be easing things very gradually, but we talk about sort of living with the virus for a significant number of months and until there's enough level of immunity. But buying some time has lots of different advantages because I think there are many clinical trials with treatments, not just the vaccine piece, but hopefully to manage the serious outcomes of illnesses and deaths as well. What I think, at the beginning, the easing off of some of these measures would be certain settings where they can manage the physical distancing and manage protocols and workplaces where you can reduce transmission. I think that all chief medical officers are thinking, you're not going to be having those giant mass gatherings. You're not going to be, having those kind of settings where we know transmission is going to accelerate really fast. People are going to be managing the size of those gatherings and having protocols in schools, workplaces, and other aspects of life where these basic fundamental hygienic measures, the policies and protocols, as well as all those public health capacities have to be in place. And you're going to have to dial some of them up again if you're going to see some cases. So I think I would love to be able to tell Canadians that life will be back to exactly where we were in December of last year. But no, we're going to be living in having different routines, different daily routines. But I think all chief medical officers sees with that we need to balance the effectiveness of measures. We need to study them, but also balancing with any unintended consequences. We know the impacts to mental health, to gender-based violence, to other aspects of society and the economy. So it is a very delicate balance that we all have to really manage very, very well. But we all understand that if the virus accelerates again, that would be a massive setback to the gains that we've already had. So we've got to keep going at it. And so I think this is absolutely still a marathon, I think.
And you've talked to us over the last few weeks about how as you get more data, you have better quality data, you get a better sense of the trajectory of it, that there would be changes in the modeling. And yet in the long-term modeling, we don't see any changes today. So what specifically is the data you are missing today that you need in order to improve the models, in order to make them more accurate or reflect better what Canada is experiencing?
Well, I think there's a suite of models, and these were the initial models for planning purposes. You've got to kind of plan for the worst, even if you're not going to actually get there, but really function so that you can achieve the best. So that is the concept of that particular type of model. And so I think all of those public health measures still hold. There are many, many modelers right now working like 24/7, I think, across the academic sector and also within the agency working with them, who are looking at these dynamic models, feeding in all sorts of scenarios of what happens when you begin to relax different measures as to what the outcomes are. And I think those were actually quite interesting to see. But the bottom line that they're going to always say is that whatever we do, and if we eased off things too fast, and we can't monitor it, you might see a resurgence and a second wave that is bigger than that initial one. And so I think that is the message that they will be trying to convey as they are doing the modeling. And it is a message that the public health arena really take to heart.
Merci beaucoup. Thank you, doctors. C'est ce qui m'a fait la conférence de presse pour aujourd'hui.
Thank you. That concludes today's press conference.